We began the Persian year with the coronavirus at our doors, and we end it as such. But news of the coronavirus is anew, as precautions taken for prevention and studies conducted for cure or immunization yield results. And the first Iranian Covid-19 vaccine is expected to come out in days in its hundreds of thousands. Phase 1 of the trial period is behind us, and we are moving on to Phase 3. To see how well Iran has done in the corona crisis and what problems this country still faces, stay with me, Leila Faramarzi, on Iran Today. Phase 3 of the Coviran Barakat vaccine has since been administered, but only just, and it yet must prove itself. But as it may be too soon to speak for the layman, the doctor managing trial administrations appears confident. Like other health specialists I've spoken to, he tends to speak his mind. That would be Dr. Hosseini, whom we met at Tehran's Hotel Aram, where trial jabs are administered and subjects are supervised for safety.
تو فاز 2 توی جمعیت بزرگتری چند صد نفری
In phase 2, in a larger population of several hundred people, we still focus on antibody production in addition to safety. That is, we want to see how much antibody is produced and to what extent that immunity is achieved by memory cells, a notion that's called cellular immunity. These are measured using different methods, for instance, with different proteins and various CD markers. In this phase, we assess them to realize what an immune response we could get in a lab setting. In phase 3, as you mentioned, we will make sure we have safe vaccine and that it produces antibodies.
Thus far, finalized versions administered to the population have been foreign vaccines, beginning with the Russian jab Sputnik 5. Iran's President Hassan Rouhani said the vaccination program will reach a remarkable level before the Iranian year ends March the 20th, with the delivery of other shipments of vaccines purchased from abroad.
طبیعتاً این تحریم‌هایی که وجود داشت
Naturally, the existing sanctions slowed down the efforts at all stages, especially in the industry sector. I'm not aware of the full extent of the problems, but those whose line of work is in the industry sector, with whom I have the honor to do clinical work, know that procuring much of resources and equipment have been extremely hard due to these unfair conditions. Of course, on the other hand, we can assume that such conditions push people to try to work more seriously.
Iran bought 2 million doses of Russia's Sputnik 5 vaccine, according to the Food and Drug Administration. And the first shipment arrived in Tehran, the capital, on February the 4th. The health minister's son is known to have received the first Russian jab to prove its safety, as it is yet to be approved by the World Health Organization or the European Medicines Agency. Dr. Motawallian is vice president of Baqiyatullah Hospital University.
Health experts are still uncertain about the stability of the Pfizer vaccine, the well-known vaccine made in the Western world, because that can only be established over time. This stability test is not such that it can be guessed or assumed that its effect is permanent. Vaccines' stability and safety can't be measured before 18 months have passed since the first and second administrations. We can't just say in the form of a slogan that 1 or 2 doses of the vaccines we have developed can achieve anything. Anyone who has done scientific work knows that this is just words.
Nearly 100 members of the board of Iran's Medical Council signed a letter addressed to President Rouhani saying purchasing Sputnik 5 before international approval could be dangerous. But Iran's health minister Saeed Namaki said Sputnik 5 was bashed for economic interests. And President Hassan Rouhani's chief of staff, Mahmoud Vaezi, said if the vaccine were to be purchased recklessly and without expert evaluation, the process wouldn't have taken this long. Iran could have accessed the vaccine much earlier due to its good relations with Russia. Sputnik 5 was developed by the Russian Direct Investment Fund, that's the country's sovereign wealth fund, and it has been given regulatory approval in 16 countries so far and is waiting emergency use approval by the WHO, World Health Organization. Manufacturers of the Russian vaccine say they have received requests for vaccinating more than 1.2 billion people from more than 50 countries. The matter of numbers always counts in administering cure or prevention and deciding their extent.
منم نظرش با شما موافقم که آمار ما خیلی بیشتره.
I also agree that the real number of those who have contracted and recovered is much higher. The 60-70,000 death toll that we have reported, considering the toll in the villages and how much access they had to medical facilities, I think is a relatively acceptable statistic compared to that of the rest of the world.
How the vaccine works is it has to be administered in 2 separate doses, 21 days apart. Following Minister Namaki's son, the medical staff at 635 hospitals across Iran were the first group to get the Russian vaccine. Never any harm in seeing what others have to say, so let's take a quick media break to see what's on offer in other news outlets before getting back to our own narration. And an actual look at other outlets, beginning with Tasnim News. What Tasnim says: Iran's war on COVID-19, a model for containing contagious diseases, says the president. The president of Iran said the country's successful handling of the situation after the outbreak of the coronavirus pandemic can provide a roadmap to tackling contagious disease in future. Speaking at a meeting of the Coronavirus Fight National Headquarters, President Hassan Rouhani said Iran has taken very great and valuable measures to control the COVID-19 pandemic over the past year. The coronavirus statistics show that the overall situation in Iran, except in 1 or 2 provinces, is satisfactory, the president added, warning though that a 4th wave of the pandemic may erupt in case of laxity in carrying out the health regulations. A look at TRT World gives us an idea of the UN's mindset. UN says US sanctions hampered Iran's COVID-19 response. UN Special Rapporteur on Iran calls for easing of US sanctions on this country. US sanctions have crippled Iran's healthcare sector, contributing to Iran's inadequate COVID-19 response, says the rapporteur. The government has faced significant difficulties in containing the virus, in part due to the weakening of the national healthcare system and the wider economy, the report citing the UN Special Rapporteur Javed Rahman's observations said, adding that the UN Secretary General has been sharing the same concerns. Rahman holds the US responsible for adding strain to Iran's healthcare sector, which was already reeling from the effects of severe sanctions imposed by the US in 2018. Tehran Times makes a mention of ITB Berlin. ITB Berlin, which bills itself as the world's leading travel trade show, has presented a taste of Iran. Due to the pandemic, ITB Berlin was held virtually from March 9th to 12th, featuring some 3,300 exhibitors from 120 countries. The presence of the Islamic Republic of Iran, particularly its private sector in this fair, shows the dynamism of the country's tourism industry after a year of closure. And we declare in this exhibition that we are ready to bring tourism back on track again after the epidemic is curbed, said Vali Teimouri, the deputy tourism chief. The number of foreign visitors to Iran plunged 94% in the first 9 months of the current Iranian calendar year, starting March the 20th, 2020, from a year earlier. Government data showed as the coronavirus pandemic takes a heavy toll on the tourism industry. And that's it for today's news segment. A joint scheme between Iran and Russia was scheduled for late March to mass-produce Sputnik 5 just before year-end in Iran. But with the Persian vaccine out and to be mass-administered by late April and early May, I asked what need there was for a Russian line, especially as the first batches of the Russian vaccine to be mass-administered will also be available in late April.
صرف این که افراد مختلفی دارن رو واکسن کار میکنن فی نفسه ارزشمنده.
The fact that different institutions are working on vaccines is valuable because ultimately the practical benefits of such attempts will be recorded and reserved in the country. But we know that some teams are more likely to succeed than the others. That's why we predict that in this process of experimentation and development, a few can get to the production phase. Both timing and the volume of production are significant.
Doctors foresee a need for 120 million doses of the anti-corona COVID-19 vaccine to inoculate 60 million of Iran's 85 million strong population with 2 jabs each. But vaccine production and mass administration is a slow process everywhere, and this country is among the few to have even attempted the feat, and attempted it has, with success. And that is in spite of US sanctions against this country.
یک مرحله تولید شده، مرحله 2 مرحله نیمه صنعتی.
Vaccine production has passed stage 1. The next stage of production is the semi-industrial phase, which we hope will provide several 100,000 doses a month, given the efforts that are being made. We expect that in the final stage, which according to our company's main goal is scheduled for June, we can produce 10 million doses.
The Iran and Russia vaccine production will take place in the facilities of an Iranian pharmaceutical company. The two countries will be producing between 36 and 40 million doses of Sputnik V in Iran within the next 12 months. They jointly decided Iran would host the operation, mainly to increase supplies of the jab to countries in the Middle East or West Asia.
خیلی از کشورهایی که در اطراف ما هستن داده هاشون به
As an epidemiologist, I believe that many of our neighboring countries aren't reporting valid data. We've always been witnessing cases being underreported for all kinds of diseases, and especially COVID-19. What I'm trying to say is that we are in much better shape concerning diagnosis and treatment compared to many other nations.
Time for a short break. We'll be back in no time. Having said quite a bit on the Iran-Russia project, I have to say a word on the Iran-Cuba vaccine, which was in the spotlight before anything else. Cuba being a country sanctioned by the US like Iran, it joined forces with this country so that the two together, that's Iran's Pasteur Institute and Cuba's Finley Institute, produce a vaccine jointly. This is not to forget, Cuba's present Cuban vaccine is among the foreign vaccines Iran will be administering, having participated in its trial period. So far, with regard to ready vaccines, Iran has imported several consignments of vaccine from Russia, China, and India. As for Iran's singular projects, 3 homegrown vaccines have undergone clinical trials in this country. Over 10 Iranian centers and startups applied to produce a vaccine. The sum of all efforts and acceptance is that Iran is looking forward to 4 to 5 homegrown vaccines now.
تو ایران حالا پلتفرم‌های
In Iran, 12 or 13 different projects are being implemented on different platforms, which are production methods in research and development stage. Of course, because some companies undertake several projects simultaneously, the number of firms that are working on the vaccines is less than this number. Some of the companies, like the Barakat Pharmaceutical Complex, are working on 3 to 4 projects at the same time. The vaccine types being developed are different too. 2 to 3 of them are the inactivated type. 2 or 3 others are the subunit type. Some other companies are working on mRNAs, and the others are working on recombinant models.
As for what Iran is depending on thus far for the shorter term, officials say Iran will receive around 16 million doses of vaccines through the World Health Organization's COVAX program. It will import more than 25 million doses from abroad, and it will produce 25 million other doses inside the country.
تنوع مختلفی از انواع
Therefore, a different variety of vaccines that we have heard about in the world are being researched and developed in Iran, and some of them are still in the laboratory stage. Some of them, fortunately, have gone through animal stage, and as we speak, 3 of these vaccines have reached the human trial stage.
But the vaccine is not everything. In the case of COVID-19, prevention is most definitely better than cure, as there is no cure but only medicine to ease symptoms and vaccines with an effect lasting only months so far. Does that mean it is not worth the effort to make vaccines? It certainly does not. Mass vaccine production and administration would break the chain of transmission and render the virus controllable. That is why masks and social distancing have been recommended and enforced.
الان شما نگاه کنید ما تو کادر درمان
Many in our medical staff aren't willing to take the vaccines because of all the uncertainty around them. We can't force them to take the shots. We can only do that after we develop the vaccine and people trust that it doesn't have any side effects. It's not possible at this point. We haven't yet established that the vaccines are free of complications.
Iran's potential in production is praiseworthy. Authorities boast every medicine which was said to be effective with the coronavirus was produced inside the country within less than 3 months. Test kits and ventilators were also produced, and the vaccine only came after.
تست پلاسما درمانی رو ما تو اینجا کلید زدیم.
We started plasma therapy here at the Baghiatullah University of Medical Sciences around late March last year. We have very professional specialists. They knew that when there was an antibody, the patient's plasma and blood serum could help cure the disease. We took it and tested it with caution from those who recovered from COVID-19 and had high levels of antibodies in their blood, which was successful. Then the Americans started doing the same thing by using our published articles.
We are here at a military bus and mobile hospital site. It boasts state-of-the-art medical equipment and facilities. Facilities that you would expect to see in a well-equipped hospital with roots in the ground. But then whatever it is what makes it unique in West Asia. Let's step in together to see for ourselves what it has to offer.
One of the drugs we had trouble procuring, especially during the second wave of the coronavirus outbreak, was remdesivir. The 100 milligram vials of this drug were very rare, so much so that patients had to purchase them at 80 million Iranian riyals per vial through black markets. Thankfully, we have no shortage right now. Remdesivir was prescribed for COVID patients who are in critical conditions. The other drug given to cases who are experiencing a less severe form of the disease and are staying at home is favipiravir. We have enough supplies of this medicine at our hospitals and aren't experiencing any shortage.
High up in the IRGC Land Forces chain of command, Mr. Akhavan is on the Mobile Hospitals Committee. He summed his pride in the project, which was inaugurated March the 14th with the Health Minister, in the few minutes he had with us on site.
Establishing field hospitals for COVID-19 patients requires special infrastructure. They need mobile CT scans, oxygen generators, and mobile PCRs. Intensive care units, especially mobile ICUs, require better ventilation with more suitable spaces and many other features. This field hospital here is a specialized unit with 128 beds. One of its characteristics is speed. This entire unit can be moved to any point in the country very fast.
Who can blame the doctors and nurses and pharmacists for savoring a brand new experience in terms of the scale of field hospital work?
I can almost say that in the past we were successful in 40 to 50% of the cases, considering the equipment we had back then, but now with the new hospital we have been able to help people 90 to 100% of the time.
The fact is that we used to provide healthcare to deprived areas in tents. But now in this perfect field hospital, we have almost everything. Everything is organized and everywhere is clean and tidy, as you see. The comfort of the staff is really very important, because I believe that if the staff does not get tired, there is no other problem. One of the problems we used to have before in the tents was the lack of order. On the other hand, tents were either very cold or very hot because of the various weather conditions. But now, thank God, all these problems have been sorted out.
Speaking of the difficulty of our work, take me for example. I have two children who are not very old. One is 7 years old and the other is 9. My husband is also in the military and has a job that's like mine. We've been here since the weekend and we may have to stay until the end of the week if no problem comes up, God willing. If needed, we have to stay here longer. This causes problems in our personal lives. Living like this for a mother with 2 kids is difficult.
Preventative measures prevail, even if at times in a haphazard fashion, given Iran's cultural and economic conditions. Travel to cities coded orange and red have been prohibited. Those are cities with horribly high rates of transmission. The government left its final announcement for New Year travel bans or easing of travel restrictions to 15th March. That's under a week to the 13-day New Year holidays. I asked my interviewees for an evaluation of the sum of efforts by the National Coronavirus Headquarters.
We have imposed nighttime restrictions for several months, but haven't enforced them too seriously. There have been countries that imposed 5 p.m. to 6 a.m. lockdowns all of a sudden, and their death toll reduced to as low as 10 people per day. Social distancing is of paramount importance at this point. No tool is as effective as distancing, even face masks, because in my opinion, masks are signs that we need to maintain our distance.
Iranians traditionally make hundreds of thousands of domestic New Year trips annually. Can you blame them, with 31 provinces to go to, each with a world-class wonder on display? Still, they have been urged not to plan trips to contagious regions, as the country's healthcare system has a limit. The public should maintain last year's lifestyle for another year, the president himself stressed. Iran is set to vaccinate enough people by the end of 2021 to reach herd immunity. The country is working on expanding all corona-related services.
So far, we have deployed 200 mobile hospitals in different parts of the country in various geographical areas. The units provide the services for a week to some 4 million people. A memorandum of understanding is being reviewed between the Ministry of Health and the ground forces to bring 10 similar units to different military bases across the country.
Goes without say, international borders have been under check with the coronavirus mutating and traveling at will. Iran began suspending flights to London in December 2020 over concerns about a surge in coronavirus cases and a new COVID variant in the UK. Also, the country in February closed 5 crossing points with Iraq to prevent the spread of the UK variant of the coronavirus again. Border customs offices, however, remained open to commerce, with traders and business persons from both countries presumably observing health protocols, of course.
Everyone was confused at the beginning of the outbreak, and even some countries like the United States said there was no problem at all. I think the health and treatment conditions of our country is unique, due to the separation of the Health Ministry and the Science Ministry, something which exists in almost no other country. Until 1985, we had a Minister of Science that trained all medical, paramedical, and nursing students. We also had a Minister of Health. Several hospitals were under the supervision of the Minister of Science to educate students, while some others provided health services. The initiative in the Islamic Republic, which I think was an appropriate one, brought together the Minister of Health and the Minister of Education. In my opinion, the universities that provide health services too have been very successful in controlling and preventing COVID-19.
As implied earlier, what has kept the country going with the coronavirus mutating and jumping borders is basic hygiene, masks, and social distancing, paired with health workers' tireless efforts and hospitals braving anything thrown at them. Hospitals have had to manage both their own resources and volunteers demanding they be trained to help. Classical hospitals, however, aren't the only ones with something to say for themselves. That's it for today. Thanks for watching from the whole team. Do return to the box at the same times next week and each week after, as you never know what's going to be on. And do leave your comments and topic requests. Bye for now.